Hi everyone, so I'm Dr. Thew. I'm a family medicine specialist. Currently, I'm practicing in healthcare clinics in government in Malaysia. Currently, I'm in Perak, and I started my houseman trainings in 2010 to 2012, 2 years houseman trainings, and then I have another 2 years experience working in primary care, and I started to develop interest in primary care when I seen the patients, and I found I need to learn more about primary care because it is actually different when you're doing your houseman training rotations in hospital and in primary care. It is a two totally different approach, I can say. And in primary care, you tend to spend more time with patients, you understand them more, and you actually treat them in a holistic way rather than in hospital. Most of the time we just give medicine, settle them, and then make them stable, and then discharge them, and then follow up. So you don't have the very deep interactions. We actually have the human touch. You know the patients very well, and you eventually you also will know the whole family's members as well. So that is why I really really love family medicines. Okay, so and then I pursue my master program in UPM in Malaysia, 4 years, and now I'm actually I graduated in 2019 November, and I started my journey as a family medicine specialist. So I have an experience working in the urban clinics like Klinik Kesihatan Kuala Lumpur, in KL, Kuala Lumpur, and Putrajaya. And also, I have experience working in the rural area clinics. Like currently, I'm actually practicing in a rural clinics where I need to go into the villages to help the poor, to increase the healthcare literacy in the communities. So it is two different experience as well. So you will enjoy it if, let's say, you further pursue in the family medicines. Yeah. In primary care, so we are always the first contact with the patients because patients always come to their family doctors when they have problems, right? So from there, you can actually develop, you can members, then you can get a rapport, build the relationship, doctors-patients relationship from there, and then you provide continuity care. So you will follow up with your patients, and subsequently you can provide a comprehensive and you can provide a comprehensive and coordination care for them. So probably when they need to refer to the psychosocial welfare, so you can actually help them to reach that to the psychosocial welfare, or they need to refer to the cardiologist, then you also can actually help them to coordinate. So that is the benefit of being a primary care physician. So you can actually tailor the treatment for every different patients. And the challenges is, I think the most is we lack of training in family medicine specialists. So not much people actually go into this field because our specialty is very general. It's not like cardiologists, they just go into the heart and learn about the heart, the angiogram, the bypass, and surgery or ONG. Of course, they have the specific field. So primary medicine is important because we need to specialize in every scope so that we can actually help to handle at our level. So when the patient is already into a critical or is in a urgent or emergency cases, so we know when to refer them to the hospital. So that is why we actually need more people to get into the family medicine specialist, so we can train more people into this fraternity. And the other thing is, I think, is a lack of choice. Lack of choices is rather subjective because you deal with different patients. Of course, every patient, their understanding and their social background is a bit different. So some patients, if let's say they can follow your treatment plan, your management, so of course it is a compatible management, so you can see the outcome. Of course, some patients they can't follow your management because of the financial constraint or some underlying psychosocial issue. So of course the challenges is you need to help them slowly how to get more get more rapport and solve the psychosocial issue first and slowly get into the problem. So it's a lot of way of handling the disease and the patient. So mostly it's go with the clinical. We treat patients. community health trainings, you can actually do it in, okay, now actually we have to separate into two eras. Before COVID and after COVID, right? Before COVID, of course, we always have the community service. We go to the housing area and we do the free medical checkup and give a talk to the patients and the community to raise their awareness. So awareness is very important here, okay? So it doesn't matter before COVID or after COVID, the awareness must be there. So we have to empower the patients to raise awareness towards the disease. Then only we teach them how to self-care and manage the disease, how to come to seek treatment if they are unwell. So that is, I think that's the most important point in the community promoting healthcare. So currently we have a COVID pandemic, so of course we try to reduce the interactions with patients. So what we can do is we utilize the digital platform. So we can actually use the YouTube, or we can actually use the sound system in the clinic while patient is waiting in our clinic. So we actually every hour we will try to announce, like, you remember to wash your hands, remember to stay social distance, remember to get your vaccine, remember to come and do the swab test if let's say you feel you have fever, cough. So we actually play that in our clinic every hourly. So our patients, while they waiting, so indirectly they actually receive the informations and raise the awareness towards the COVID, of course. So but this part is a big challenge, especially if let's say your area there's a lot of elderly where they do not know how to use a digital handphone or the applications, and also poor, I would say, the financial problem. So in these patients, how we going to educate them is we try to ask them to bring their children, the caretaker, so we can educate their children and the patients together to raise the awareness. This digital learning is very important, especially now. So actually it is very flexible, and then it's actually we can actually help to spread more educations to the people. So that is why if let's say the policy maker or the government can come into this, so probably government can help to set up the free internet access to the village and help to install the internet, and then they can see the digital, so they can receive the information. So this is very important, but not to forget the practical part. So I think the challenges would be the practical part, as you know that doctors, you actually need to touch the patients, examine the patients, so that you can gain the experience in handling the patients. So digital learning is just it's very good, but it's just a concept of theory. You still need to practice it. So how to bring the practice along? Probably I think later they have a 3D module, and then you can actually like touch on the couch and then like pretending that it's a patient. So probably that will be coming on later on. So I think that's a way to do it. Stress definitely is a main cause for every diseases, not only diabetes, obesity, or hypertension. It actually can be a mental problem as well. Stress also can lead to depressions as well. So it is an issue that we shall actually try to encourage our patients to voice out. You see, most of the time when you ask the patient, so hi, how are you coping? They say, oh, I'm fine, I'm well. But actually when you go deeper and you start to talk about, so how's your work lately? So are you able to go to work, or are you able to finish all your assignments by your boss? And then they will start to say, oh, lately I think I'm quite busy, and then I think I miss my task or something like this. So they will elaborate more when you go into the details. So I think we shall actually encourage our patients that don't be ashamed, or don't feel like ashamed when you tell patient that I'm very stressed, I can't cope anymore. So we shall actually encourage them to open up, to talk their emotions, and then the support group. The support group is very important. It's either they can get it by their own families, their friends, or NGOs. We have to gather the NGOs to come into this. Yeah, the effect. Okay, just now to answer your questions, like the stress into the diabetic. Yes, stress definitely will make the diabetic sugar out of control. They will binge eat, and then the sugar, of course, will go fluctuous. And obesity, same goes to obesity. binge, and then the weight also go haywire. And hypertension, definitely they cause their uncontrolled hypertension as well. So I think we need to manage the stress. So probably we shall actually start with encourage our surrounding people, not only doctors can play a role, but actually we can actually start to encourage our friends, our family members to ask them to voice out, to open up their feelings, so that we from the small part and then spread into the big part, so they can actually come to talk to the doctors. So usually I'll tell my patients, so one day, I mean, especially they are very stressed and they can't cope, they are perform poorly. So I actually tell them, if let's say you need help anytime, you just walk into the clinic and say you need to speak to the doctors. So at least we can address their depressions, or sometimes they actually, even though sometimes they can have a suicidal ideation as already. So you can actually take the opportunity to encourage them. Don't be shy, don't be ashamed. It is a small matter, just like you can actually tell them it's just like a hypertension, you got a medicine to cure it. Stress also, there's a medicine to could cure it. Sometimes we can actually teach them how to do a breathing relaxation technique, the CBT, the simple cognitive behavior therapy, and also we can later on we can actually help them to coping skill. So this is all in the primary care management. So I think the COVID pandemic actually hit us in end of 2019. Okay, so we know that in March, actually I think Malaysia is actually started the MCO movement restriction order. So at the time in primary care, so we know that our setting need to be modified. We need to change to adapt to the pandemic. So the first step we do is actually we move out all the fever patients we see outside the clinic. So that the patient it wouldn't mix together with all the chronic diseases patients. So what we do is we take the tents. We set up a tent, so it's a open space. So we set up a tent, so we see all the fever patients, the cough patients, and the upper respiratory tract symptoms patients all see outside. So with the full PPE. So that is one of the modifications we are doing now. And then second, we help to do the swab testing for those symptomatic patients and those contact to the COVID patients. And then later on, I think by this year we have a vaccine, right? So primary care, we also start to bring in the vaccine, and we try to speed up the vaccine pickup rate to the community. So I think we actually do this in, like the Wonka. If let's say you know about Wonka, it's like the family medicine, world family medicine. Primary care is the first in and last out, definitely. So we actually, when the pandemic hit us, so we need to find a choice. We need to find a strategy how to fine tune it. So that's why we move the fever clinic outside the clinic, so we can less exposure to the elderly patients and the non-communicable disease patients. And then next we help to we increase the testing to so that we actually can help to confine the infective area, so that they can actually quarantine properly at home. And then the other thing is the new thing. I'm not sure other country how they do it. We actually have a CAC, COVID Assessment Center, because as you know, most of the hospital, their capacity, they cannot cope anymore. So that is why primary care help to reduce the admissions by follow up the Cat 1, Category 1 and Cat 2B patients, where the patient is no symptoms but COVID positive, or they have a very mild symptoms, COVID positive, provided their household quarantine is suitable with a suitable caregiver. So we actually follow up them until day 10 of the quarantine period by phone call, and also come to the CAC assessment center. So we actually is multitasking, and meanwhile we're still running our clinic. So actually it's like I say, if let's say you read my article, the primary care, there's one article of my LinkedIn, there's one about primary care. I'm quite, I understand my staff, they are actually burnt out, but I appreciate the teamwork. They actually still hold on and give their best in the service. So if let's say you really look into the definitive of the, if let's say you look at the definitions of the precision medicine, it is not the solely personalized medicine. It is more on the precise for the for the testing and the treatments. So the treatment wise, it will still be more or less the same, but we actually can opt a different subclasses of the treatment for the certain patients when the genetic is already come out that maybe group A patient is more sensitive towards the metformin, so you can actually put the metformin in their treatment, or the group B patients, they are more sensitive to the saxa, so you can put the saxagliptin to them. So yes, I think this is good evolutions. I think it's important as well, and also it save money. Eventually you see the cost of the genetic is actually coming down so drastically. You can actually no need to spend the cost of doing the lab test and the radiographic images, and then you can actually direct from the gene. But the challenges part is how are you, is the ethics. Is the ethics come into the, I think a lot of study they are doing all the genetic coding, but then when come into the real practice, I don't know whether they think of this about, I don't know whether they actually think of this problem or not. So when come into the real practice, you really need to counsel properly on the ethics. And then I think in the Sweden precision medicine, they also got a few court case, like the mother know about the gene, and then they didn't tell the doctor, and then eventually the doctor also got the genetic disease. So yeah, some sort of the ethics issue there. So I think this part we need to train properly and go into this. And then the second is we actually can we also need to have a standard guideline when to do the gene testing, who to offer. Yeah, you can do before the pregnancy to screen them for the genetic disease, or the congenital disorder like the Down syndrome and all these things. So that is one way. And then how about the children itself? When you're going to check, is it okay for the children under 18 years old or after 18 years old? So that is also one part. So if let's say you check, also there's cases like you will actually indirectly detect the certain gene. So when is the time that you actually need to tell the patients, even though you if let's say you check, you get a gene of a 18 years old boy, and then you see there's a high risk of diabetic. So but the boy is well fit. So when are you going to tell the boy and say, oh, are you going to get diabetic? So it will like affect the psycho emotions to the patient as well. So I think this is more on the details part. We need to come into the research on the behavior intervention. How is the accepting, and then the setting, is it suitable, and how we going to do it? Of course, the advanced country like America, China, they are start practicing, but yeah, we need to look at, for a good plan, you need to look at the poor and the rich, where you can get a balanced management for both. This is for the WHO, the best buy strategy. So I think we need to look into this as well. So yes, I think by that time primary care will be handle precision medicines. We will talk to our patients, and because we follow up from womb to tomb, right? So from pregnancy itself, we can talk to the mother. If let's say the mother want to do the genetic testing, fine, we counsel and we tell them the risk, and so they make the decisions. So when the baby born, and then we follow up the children's vaccine, and then their growth, obesity, childhood obesity, or the height, and also other certain diseases. So from there, we can actually until maybe they already reach 18 years old, by the time probably they want to go for genetic testing, then we can counsel for genetic testing. And then of course, before this, maybe we already know that they have a disease high risk towards the diabetic. We actually emphasize on the behavior changing. We can actually emphasize on how to look at their diet, how to control the portions, how to set in the physical exercise. So from there, then we can follow up until they reach adulthood, and then later on geriatric age, so the elderly populations. Yeah, it's interesting, but I think, yeah, I actually started to look into the precision medicine I think lately. So I find it interesting, but I don't know where to, frankly speaking, I don't know where to set a point for primary care in precision medicine to go into it. But I know this will be interrelated to primary care as well. I think first of all you have to choose what are your interests. If let's say you're interested in surgery, go ahead surgery. If let's say you're passionate about human, you're passionate about human touch and holistic treatment, or multitasking like primary care, so go ahead for primary medicine. You will gain a lot of you enjoy what you are doing. So that part you enjoy what you are doing. Stress definitely we have, because we actually a lot of the multitasking and a lot of the burden. So what my tips is, when I come into work, I'll try to stay focused for work. And I'm kind of quite grateful, because my family members, they are quite understand, so they rarely disturb me and call me. But I do tell them, unless there's a life threatening or there's an emergency issue, you need to call me, whatever. So I will actually attend to my family members. So that is the tips. We need to open up, talk to your family members so that they understand you. So that is one part you need to tell your family members, so you can stay focused at work and also plan your work. You need to prioritize your work. Doesn't matter you are in what field of job, because when you don't know how to prioritize your work, you will lost of the direction. You don't know which way to focus, which way you spend more time on, and then which way you have not enough time for the critical patients. So you need to be very focused, and you need to be very clear what are you doing. So family medicine doesn't matter. So it's in at work or with patients also, you need to be very clear how much information do the patients can digest during your consultation. If let's say patient already overwhelmed, there's no point you keep on talking. So that's why you have to have the skill to communicate with the patients, understand what are their needs. So you are very clear and very focused, then you will know what is this will ease your workflow very much. And then for the life balance, right? So when I reach home, off day, I will just stay aside from my work unless there's an emergency again. Otherwise, I will just have my own life. Usually I enjoy gym. Last time before COVID, I used to go gym after work. So now actually I subscribe the Les Mills and then do the body combat. I enjoy body combat. I just do body combat, the punch and hit, right? So that's an exercise set in to take care of my mental and physical health, the health, and also listening to the music, Netflix, and also writing. I do enjoy writing the small story, my thought, and then like I share in the LinkedIn. So this is the work-life balance. Always remember to reflect back. So sometimes in life, I think it's good to have a small diary, or you can use the apps, the things to do. I think there's one app, things to do. Just use the app to help you to prioritize the job, and then always check back, reflect back, whether you already achieved your goal or there's thing you need to follow up. Then you will, when you are more systematic, I think the stress will. Eventually, everyone will have stress. It's either the stress you are still able to cope or cannot cope, right? So it's like you need to be very I think systematic. If let's say you are a very systematic person, I think you will have no problem in handling the stress.